My name is Jullian Gorski. I'm a pediatric resident physician at Indiana University School of Medicine. My project was overcrowding is associated with left without being seen rate in the pediatric emergency department setting. Some background, there are a number of risks associated with left without being seen patients in the emergency department. These include safety, medical legal, patient experience, and financial risks. We know that ED overcrowding is thought to contribute to left without being seen rates. The National Emergency Department Overcrowding Scale, or NEDOCS, is a well-validated tool that has been developed to estimate crowding, developed by Dr. Stephen Weiss. There are a number of previous studies that have attempted to examine an association between left without being seen rates and NEDOCS scales in general EDs at the department level. Our objective was to determine whether an association exists between NEDOCS and patient-level left without being seen risk in the pediatric ED setting. On to our methods, we conducted a retrospective observational study using electronic health record and administrative data at our large quaternary care children's hospital. Greater than 50,000 ED visits per year are seen in this ED. There are approximately 20 beds for higher acuity patients, as well as an additional area for fast track or low acuity patients. Patients were seen from March 2nd, 2018 through May 2nd, 2019, and no patients were excluded for the study. A number of records were extracted, including emergency severity index, sex, race, ethnicity, age, insurance type, arrival mode, county of residence, as well as date and time stamp of arrival. NEDOCS was captured at 15-minute intervals for the entire 14-month study period. There are 5 dimensions incorporated into this score as developed by Dr. Weiss, including ED occupancy rate, ED admission to bed ratio in the hospital, the longest wait time of a patient in the ED, the longest waiting room wait time of a patient in the ED, as well as the number of ventilators in use in the department. Each NEDOCS score was matched to the time that a patient arrived initially to the ED. There are 6 NEDOCS categories as defined in the original study. The NEDOCS score itself ranges from 0 to 200 and is divided into increments: not busy, busy, extremely busy, overcrowded, severely overcrowded, and dangerously overcrowded. Our data analysis was performed using Stata 15.0. Our final model was a multiple logistic regression, with a dependent variable being left without being seen, disposition, and our independent variables included the NEDOCS category and our mentioned controls. Because none of the patients in this study left without being seen who were in the not busy category, the busy category was used as our reference NEDOCS. On to our results. 54,890 patients were seen during the study period. Just over 1.2% left without being seen. Here you can see a bar graph demonstrating the distribution of NEDOCS scores assigned to each patient on arrival. On to our results of our model. So here are the results of the controls incorporated into the model. Each variable listed here was significantly associated with leaving without being seen. EMS arrival and Hispanic or Latino ethnicity were protective against leaving without being seen, while patients who lived in the county of the department, as well as those of African American race, were more likely to leave without being seen. Those who are self-pay, those who arrived during the evening or overnight relative to the day shift of 8 to 4, and those who arrived during a weekend relative to a weekday were also more likely to leave without being seen. Not included here are the emergency severity indices, where we saw triage levels 3, 4, and 5 were more likely to be associated with left without being seen risk. On to our NEDOCS model results. With each increasing NEDOCS category, we saw a huge jump in proportion of patients who left without being seen. So from the busy to the next step, extremely busy category, patients were 9 times more likely to leave without being seen. When you look at patients in the dangerously overcrowded scale, these patients were 135 times more likely to leave without being seen. Impressive enough, this is demonstrated here on a logarithmic scale. Here we show the projected left without being seen versus NEDOCs. We see that the 1% threshold is crossed at a left without being at a NEDOC score between 100 and 110. In conclusion, we show that an association between NEDOCs and left without being seen rate exists. We see that NEDOCs has the potential to capture left without being seen risk in real time. And we also see here that interventions to mitigate NEDOCs may also improve left without being seen risk. Here are my resources, and thank you for listening.